a special session being conducted for the current scenario that we have for COVID. So, according to WHO, more than 5 billion individuals were fully vaccinated with COVID-19 vaccines. However, as of last week, more than 651 million people were infected with SARS-CoV-2 and over 6.6 million people died due to COVID. Furthermore, a sudden surge of COVID cases was reported in China and Japan over the last few days, with several new variants and subvariants of SARS-CoV-2 being identified. So, to learn how to deal with the new waves of COVID-19, join us today in this session with the eminent pulmonology and critical care medicine specialist, Dr. G.C. Khilnani. Welcome, sir. Dr. Khilnani is the chairman of PSRI, Institute of Pulmonary Critical Care and Sleep Medicine, a leader in his field, having more than 41 years of experience. Dr. Khilnani was also the head and professor of Department of Pulmonary Medicine and Sleep Disorders in AIMS, New Delhi. He did his fellowship in critical care from Mount Sinai Medical School, New York, USA. He's also the chairman of Credential Committee of Indian Society of Critical Care and Medicine and member of governing body of the Indian Chest. Past president for the past two terms for the National College of Chest Physicians from 2011 to 2013. He's also a senior editor of the Critical Care Lung India and member of many editorial boards like Journal of Critical Care Medicine, Indian Journals of Chest Diseases, etc. Dr. Khilani has been particularly actively involved in disseminating COVID related knowledge to healthcare groups and public at large. We are thrilled to have you on board, sir.
Thank you.
To
Thank you.
begin, sir, please talk to us about the new, or if I should say, the surge in COVID situation. Where are we lacking? How are we prepared? What is the current situation?
So that's the first and foremost. Thank you for inviting me for a generous introduction. I'll take you to what is coronavirus. Coronavirus is an RNA virus. When we were teaching pneumonia to our students, the coronavirus always figured as one of the causes. It's not that coronavirus is new. But what came out in 2019 November was a novel coronavirus. That means it was one of the variants of coronavirus, which was termed by WHO as COVID, COVID virus. And then it has actually changed our world. And I have been associated with right from the beginning of it as the pandemic was reaching India. And we didn't know how to diagnose. The facilities were limited. We didn't know the exact treatment for that. The contagiousness, of course, we knew that it was spreading, and there was a three-member committee which was formed to look at the preparedness of Delhi under the chairmanship of Dr. S.K. Sareen. I was one of the three members. And that time we were discussing if there are 5 cases per week, per day, what we'll do. If there are 50 cases, what we'll do. If there are 500 cases per week, then what we'll do. And we didn't realize that it will run into thousands. So the first wave came, and we saw the havoc. There were limited facilities for testing. We did not do exact way how to treat these patients, and people were dying more in Italy and so many other countries, but also in India. And there were no vaccinations. And then quickly the vaccinations were developed initially by United States, and India was not far behind. And India also took charge of developing vaccine in a quick manner. And Covishield and Covaxin. Covaxin was the original Indian vaccine. It was, and then doctors and all got vaccine for them, and then elderly and all. So when the Delta wave came, then doctors were vaccinated. Some of the elderly were vaccinated, and but the public at large was not vaccinated. So we had an havoc of Delta wave, oxygen shortage, people dying on the roadside, people dying in the emergency, and then crematorium were full. All those things I'm telling you to give you an idea. But then came the third wave of Omicron wave. Now, Omicron wave was killed a lot of people in Hong Kong and other countries. we saw large number of cases, and but there were no deaths, or there was no significant increase in the ICU admission and deaths. And I witnessed all the outbreaks, you know. So this Omicron wave was mild. First, it was a virus which was contagious, but in Hong Kong it killed people, but in India it did not kill. The reason was that by then a large proportion of Indian adults were vaccinated. More than that, more than 90% of all of us were at least infected once, whether diagnosed or undiagnosed. Now, that means that we had hybrid immunity. What is hybrid immunity? Hybrid immunity is the one which is obtained by infection plus vaccination. And that is the most robust immunity. And another thing is that we initially thought that vaccination prevents from getting infection with COVID. You know, all the studies done in United States, done with Covaxin trial, done with Covishield vaccine. But subsequently, we realized that vaccine does prevent infection to the smaller extent, but the larger extent it prevents severity of disease, so that people don't go into the ICU and people don't die. That is the reason that the Omicron wave, which came early last year or end of early this year, uh, infections were there, but the deaths were very few, and only people who died, majority of them, they did not die because of COVID. They died with COVID. Means person who were severely ill, or you know, with cancer and with terminal heart disease or severe, and 80 years plus, 90 years plus, they were admitted and found to be COVID positive, but the cause of death was not pneumonia caused by COVID. Cause of death was their basic disease compounded with advanced age and frailty and so on and so forth. By now, if I talk about, more than 90% of adults or 95% of adults are already vaccinated. We have all acquired hybrid immunity because we are all infected. Now, this virus, which BX7, which has been supposedly causing havoc in China and also Japan and also in South Korea, and even Europe and America is also witnessing increase in the infections and some deaths also. There was a paper in JAMA 1.5 months back where they reported that the people who are elderly, that means 80 years plus, and those who are immunocompromised, there are excess deaths because of attributable to COVID, presumably Omicron. So, so that's the summary. What we are today now, from the China or Japan or Korea, from wherever the virus has come to India to a smaller extent. You know that there are reports of uh, by genome sequencing. There are reports from Agra and some from Gujarat and from Odisha that people have found to be COVID positive. Some of them we know have traveled from these countries. Some of them we do not know. But so far, there is no evidence of severe disease or significant increase in the deaths. Why I'm telling you all this is that there's no need to panic. We need to be careful in the form of surveillance for reducing the transmission. Whosoever is coming, and there's already a list of 6 countries which are there where RT-PCR would be required. That order is awaited, and the government of India has been extremely uh, quick to react, and they have actually taken all the precautions of testing travelers and isolating them. So there's nothing to be panicked about, but we have to safeguard our elderly and those who are immunocompromised, who are at somewhat risk of death and serious illness because of with the COVID infection. So therefore, we should take all the precautions to slow down the transmission. So further, as you ask me questions, I'll be answering. That was my introduction.
Thank you so much. I think rightly said, as if you said, there's no need for panicking and stuff. There have been questions about, a doctor says, Dr. Uma Alagappan asks, does COVID-19 infection routinely need antiviral treatment?
That's a wonderful question. I didn't touch upon that. The antiviral drugs used, which was found to be effective over a period of time, was a remdesivir, which was used only for critically ill patients. And subsequently, a study found that if you give remdesivir three dosages in the beginning of the illness, this reduces the severity of infection to the tune of 70 to 80%. Subsequently, in India, we use molnupiravir, which
Mm.
also led to diminution in the severity, but the diminution was to the tune of 30%. There was another drug called Paxlovid. Now, Paxlovid is a combination of ritonavir and nirmatrelvir. There's tongue twisting name, but you can remember Paxlovid. This was used extensively in United States, and its efficacy in reducing the severity of was equal to remdesivir, that is 70%. But now, the Indian company has got a nod from US company to manufacture these drugs, that is Paxlovid, in India. So over a period of time, soon enough, this drug will be available, oral drug given for a period of 5 days. Now, everybody should not, there's no need to give this Paxlovid or Molnupiravir to everybody. This is to be given to the people who are at high risk of serious infection. And I need not decide hypertension, diabetes, CID, elderly or immunocompromised, those who have rheumatological diseases. Whosoever is immunocompromised or elderly is a candidate for receiving Paxlovid or Molnupiravir in order to reduce the severity. Now, although we are saying that this BX7 uh, is a Omicron subvariant, so we hope that it will not cause severe disease, but nevertheless, if this wave comes to India, then Paxlovid will be very useful for reducing the severity. As far as the remdesivir is concerned, this is a standard drug for treating severe disease. It is a standard drug for preventing severity of disease if given within 5 days. And there's also an evidence, scientific evidence, that if you treat a patient with remdesivir, the long COVID, which is a big
Mm.
problem even now,
Yeah.
the severity of long COVID reduces if the patient has been treated with remdesivir during his illness. So antiviral drugs have come a long way. Some of the drugs which we use in the beginning, like azithromycin, they are not antiviral, but HCQ, hydroxychloroquine, and all these drugs were given up. No, none of the trials showed any benefit besides these medications. Thank you.
Thank you so much. I think you did talk about the vaccination bit, so there are a few more questions on those. So, is a universal vaccine possible for COVID-19 first? Because there are many variants. And are unvaccinated people actually responsible for the new wave of COVID?
Not really. As I said, firstly, there are very few unvaccinated people. As far as you go about the population, as I said, more than 92%
Correct.
are fully vaccinated. That means they have received two dosages. And unfortunately, only 26% people, adults, have received third dose, which is called precautionary dose. And I have been saying aloud that please come forward and take third dose also, so that your uh, immunity is boosted. Because we know that over a period of 6 months, the antibody level after the vaccination goes down. And these are scientific studies which are done. But as the threat or havoc or the fear of COVID went down, people stopped coming forward for vaccination. Although the government had provided all the facilities, Now that the nasal vaccination has come and it is approved for even boosting,
Correct.
so this will be soon available after a week or so, I hope. Then everybody should come forward and do a third dose or precautionary dose. In fact, the medical fraternities have been requesting that there should be fourth dose also available to Indians. In United States and Israel, they have all have received four dosages, but in India, the three dosages are permitted at this point of time. Talking about the efficacy of vaccine, both Covishield and Covaxin and another protein subunit, and now the nasal vaccine, all are very effective vaccines. So therefore, whichever vaccine you get, they are amazingly safe because 220 crores vaccinations have been given and they are very effective. That is exemplified by the fact that during Delta wave, the vaccinated people were saved from having severe disease, and that is a sufficient evidence for us. Now, why China is having so much of cases with the same virus, and we are not that scared because in China, uh, only 60% of elderly were vaccinated, unfortunately. And there were issues about their Chinese vaccine, Sinovac vaccine. Experts think and believe that it's not as effective as other vaccines like mRNA vaccine, but we know very little about that. But there must be some reason. Another thing was that I'm drifting from this subject to complete the value of vaccination. The China had followed a zero COVID policy. That means that during first and second wave, when India had several cases of clinical cases of COVID, China had sort of went into the lockdown, and there were no they were able to stop the transmission of disease, with the result that people were not infected, leading to lesser immunity as compared to Indians. So they did not have hybrid immunity. Their vaccination rates were exceedingly poor, and their vaccine had issues of efficacy, which we understand were there. These were the three reasons that China has seen cases and deaths, and ICUs are full, and crematoriums are full, as we see on social media and television. But India is vaccinated. The vaccines are very effective, and with the hybrid immunity, we are pretty good on that.
Awesome. You did talk about the vaccination. How effective has been vaccinating the children? Because we saw a lot of cases being, because there was a lot of interaction since the schools have opened now and kids are falling sick. So, how effective has been the vaccine for the children here in India?
So, if you go into the history of coronavirus, in SARS and MERS,
Hmm.
two outbreaks were there, you know, 2002 and 2012 respectively. During 2012 outbreak, the death rate was something like 50%, close to 50%.
Okay.
And none of the children died. So, by history, we know that coronavirus causes very mild disease in young children,
Yeah.
and serious disease is very, very uncommon or rare. So there is always a question whether the children should be vaccinated at all, because but when you want to attain herd immunity, because if the child may get fall sick or get viral infection, corona infection or COVID infection in the school, but he'll go home and infect rest of the family, his grandfather, grandmother, whosoever susceptible people are there. So therefore, the efficacy of vaccinating children should not be measured by reducing the ICU stay or the death or the infection. The vaccination of children should be measured because of the vaccinating the community at large. So I do not have data as to how much uh, this vaccination has prevented infection in children, but I think it is important to complete the vaccination of the whole community or whole population.
Correct.
And just to tell you that Indian proportion of Indians who are vaccinated are much more than the United States. In children and adults both. So my opinion is that all children should be vaccinated.
Okay. Now, sir, talking about the new variant or the new subvariant. So WHO has declared that BF.7 subvariant is a variant of concern. So do you think it can also cause severe disease in individuals,
So
especially in
that,
the long and especially in the long?
that's a good question. It's a very it's a variant of concern. That is true. It is causing deaths in China and Japan and South Korea and to some extent in Europe and America also. But it boils down to the same thing. When we talk about the disease, we used to study in community medicine agent, host, and environment. You know, so the environment, of course, is depends includes everything: the temperature, the human behavior, the transmission, the overcrowding, and all those things. Agent is BX7 Omicron. The host, it is it is it is the immunity of host which determines the severity of disease. Same host, same agent with the different host will behave differently. So that's what I said, that since we have hybrid immunity, and I'm saying at the cost of repetition, that vaccination and the previous infection uh, does not lead to zero infection rate. It leads to infection do occur. And I'm sure you also know some of us have had infection 2 times, 3 times, four
Correct.
times, despite being vaccinated. But the behavior of COVID is such that people who have got immunity, hybrid or vaccine, they don't get severe disease. They get infected, they become RT-PCR positive. So therefore, uh, it's a variant of concern which has caused severe havoc in China. But India, my personal opinion is based on whatever I know that it will not cause severe disease, at least in healthy people. Will not cause the wave, the kind we saw in Delta or the first wave. But it is likely that number of infections would rise. There are two reasons for that. Whatever surveillance you may do, after all, RT-PCR will pick up 80% cases only. The sensitivity is 80% or 70%. So 20-30% you will miss even on testing. Number one. Number two, there are some travelers would be in the incubation period. That means they already contracted the virus, but have not yet developed the disease, and they will be tested negative. So even if it comes, then because of our immunity, the transmission will be slow, and serious disease is unlikely in at least healthy people. But we need to protect our elderly, 70, 80% years plus, and the people who have other comorbidities. For that reason, it is important to prevent the transmission or slow the transmission. That is why all the public health measures, including the wearing of mask in the
Correct.
public places or where there is overcrowding, going in the buses, aircrafts, and so on and so forth, maintaining somewhat social distancing and hand hygiene would help in slowing the transmission. But this virus has already reached India, but I don't think it will cause havoc. Right.
Sir, it is also said that this new variant can escape antibodies that have been derived from the vaccines targeted to the original Wuhan virus, especially the Chinese vaccine Sinovac. Is this is the reason why there exists a COVID wave in China today?
I have already narrated the reason for COVID. It was because of the zero vaccine, zero COVID policy, and
Correct.
the issues with the. If you remember, 1 month back there was agitation in China. People did not want lockdown. They wanted social life and working life to open up.
Correct.
This is because of that. And the relationship of antibody level to prevention of infection is not linear. Meaning thereby, if you have an antibodies of 3,000 units, you are not 100% prevented from infection. You can still get infection. I have not talked about the cell-mediated immunity, what is in common language called memory cells. It is the cell-mediated immunity which is more important. Even if you are vaccinated, your antibody levels may be low, but if your memory cells are there for the COVID, as soon as the infection will occur, the immunity will take care and will reduce the severity of disease. So infection would be there, but the severity will not be there. Another thing I want to there point out, the nasal vaccine is expected to reduce the rate of infection because providing robust mucosal immunity because virus enters through the nasal mucosa.
Correct. Yeah.
So therefore, nasal vaccine has an additional advantage of besides being simplicity and not requiring injections and all, that it is expected to reduce the rate of infection. But at the cost of repetition, somebody should not be feel protected just because his antibody level are 3,000 or 4,000 or 5,000. Conversely, somebody should not be scared that despite vaccination, his antibody levels are not come up. I know people get worried. Oh, antibody to bani nahi meri. मैंने तो वैक्सीन लगाया था. It's not there that way. You and me have seen people getting infected with very high level of antibodies and other way also. So therefore, there is no wisdom in getting antibody levels done and you know trying to make out whether they are uh, protected or not protected. If you are vaccinated, you are vaccinated. Thank you.
Sure. So last two questions. So now you talked about vaccination. So should we be prioritizing certain category of people to take the booster doses, or have we reached that herd immunity now?
So herd immunity changes with the contagiousness of the virus.
Okay.
Now this BX7 virus has R naught factor of 16. It's very, very contagious. So for this virus to, to have the herd immunity to protect from this virus, the percentage of people immune has to be very large, very large. Initially, we said 60% are vaccinated, it won't, that is Wuhan virus. But
Hmm.
as the contagiousness increases, as the R naught factor goes up, the percentage required is very high. The question that you ask, who should be vaccinated?
Correct.
So there are two issues as far as the benefit of vaccine is concerned. One is that attaining herd immunity, from that purpose, everybody should be vaccinated. If you have to prioritize, as happened in 2020 as vaccination came, that time prioritization was done and healthcare workers and elderly were the first to get vaccine because they are most at risk. Healthcare workers because they were treating patients and elderly and those with comorbidities. In fact, elderly only because they were at high risk.
Hmm.
But we have crossed that stage. Today, there is no shortage of vaccine. Vaccines are available. It is true that benefit will be more for elderly and those with comorbidities if we have to prioritize. But currently, vaccines are freely available. So I think everybody should be vaccinated because to slow the transmission, the immunity of the community at large is important. Thank you.
So we've received a question from Dr. Ravi Sankar. He says, is it safe to use hearts from COVID-19 positive patients for transplantation? Going very clinical, very
I,
clinical.
I don't think we have answers for that, but if the person and the person receive, I mean, whoever is donor who has had COVID 1 year back or 2 years back, for that matter, as I said, India almost everybody has had COVID, and the COVID has occurred in the past. I don't think there's any. any objection or any contraindication to transplantation. Currently, should not be COVID positive.
Correct. Yeah.
That's the most important.
So now there's a question about comparison between, vaccines. So in a Malaysian study on comparison of deaths due to COVID-19 infection post-vaccination, it was found that one death after AstraZeneca, which is the same as Covishield in India, there were 2.5 with Pfizer and 9.5 with Sinovac. Do you think Covishield has helped us against BF.7, the new variant?
Uh, I would put it other way around. There's no reason why it should not work for
Okay.
PX7. It worked for original Wuhan virus. It worked for the Delta virus, and it will work from, because that's an Omicron virus. It will work for Omicron virus also. The question of uh, uh, particular type of virus or sublineage, as you call it, comes when you talk about antibodies.
Hmm.
But as far as the vaccination is concerned, it provides both type of immunity, cell-mediated immunity as well as humoral immunity.
Correct.
So the what we are focusing on the cell-mediated immunity, which reduces the severity of disease. So therefore, my thinking is that any Omicron virus, this this vaccine, all these three vaccines that you talked about, would be effective.
Okay. Now that we've received another question, I'm also adding it on the chat for your reference. This is from Dr. Manohar from Abu Dhabi. He says, what is the role of EU child injection, which is currently advocated?
No, I don't know anything about
Oh, okay. No
this.
issues. So I think these were the questions we had, sir. And again, I would like to, I guess the entire nation some has somewhere placed their bets again on herd immunity and vaccination. And we're very thankful to you, sir, for taking out time and
Thank you.
sharing your expertise on this pressing search. Um, Thank you so much. And we would like to close our discussion here. To our dear audience, if you have any more questions, do write to us. And thank you so much for your interaction and loyal viewership.
Thank you.
Um,
Thank
a big shout out to the Dr. Access team as well for having such hot topic trending discussions. And for everybody, let's stay connected and do our bits for a controlled care. Have a great evening ahead. And thank you so much for joining. Thank you so much, Dr. Khilnani. Bye bye. Good evening.